Come in.
Hello, Kayla. How are you today?
Good.
What brings you in to see me?
I have mid back pain.
What happened to your back?
I heard it doing a front on floor.
About how long ago?
3 weeks.
Where exactly does it hurt? Right in there. Does the pain go anywhere else, or does it stay right in there?
No, it stays there.
Okay. How would you describe the pain? Is it sharp, dull, achy?
Doing some things that's sharp, other than that's like kind of there.
Does the pain come and go, or is it constant all day? Okay. Is there a certain time of day that it's worse, or is it pretty much the same?
It's the same.
What makes it feel worse?
Like bending over.
Okay. What makes it feel better?
Laying down.
Okay. Have you tried to take any leave or anything? Does that make it feel better?
A little bit.
On a 0 to 10 scale, what number would you rate the pain?
4.
Okay. What do you think's going on with your back?
Probably just a strained muscle.
Right, so I'm gonna go on for your past medical history. Have you ever been in the hospital?
Yeah.
For what?
Cat scratch fever and an eyelid surgery.
What years were those?
2005 and 2007.
Have you ever broken any bones?
Yeah, my broken clavicle and my finger.
What year were those injuries?
2006 and 2019.
Any other injuries, surgeries, or hospitalizations?
No.
Right. You don't work, or do you work? Okay.
No.
So no occupational. Do you have episodic illness that kind of comes frequently?
Yeah, I have seasonal allergies, sinus infection, and strep throat.
Okay. Do you have any chronic problems like asthma, diabetes, cancer? Okay. Do you, we'll go into your family history. What kind of medical problems does your dad have?
Bipolar.
Hypertension?
Yeah, and stroke.
Okay. What about your mom?
Anxiety.
Okay. What about your mom's mom?
Skin cancer and anxiety.
Is she still alive?
Yes.
What about your dad's or your mom's dad?
Smoke, alcohol, hypertension, and COPD.
Okay. And he's still alive?
Yes.
What about your dad's mom?
Heart attack and hypertension, anxiety.
Right, and she's still alive?
Yes.
What about your dad's dad?
Yeah.
We don't know. Okay. Move on to, do you go to school?
Yes.
What grade are you in?
9th grade.
Are you getting good grades?
Yes.
Do you have a little bit of friends or a lot of friends?
A lot of friends.
Who do you live with?
My mom, my stepdad, my 3 siblings, and my 2 dogs.
Have your parents been divorced for a long time?
Yeah.
Okay. Or do you feel safe at school and at home?
Yeah.
Okay. Do you have any substance abuse problems?
No.
Any treatment for psychiatric problems like anxiety or depression?
No.
Go to your current history. Are you allergic to any medications?
No.
Do you take any medications?
No.
Do you have any environmental or food allergies?
No.
Do you use tobacco, vaping, smoking, any alcohol use?
No.
Any heroin or drug use that you've experienced? What are some of your favorite things that you like to eat?
Burgers, vegetables.
Do you eat fruits and vegetables every day?
Yes.
Do you eat sweets every day?
Yeah.
How much exercise do you get a week?
Every day.
Every day? How many hours a day?
Either 4 or 2.
Okay. What about sleep? How many hours do you get a night of sleep?
Like 7 hours.
Do you feel well rested getting the 7 hours of sleep? Okay. We're going to move on to the review of some of your systems here. Have you had any fevers, chills, sweats? Right. Any rashes that you're worried about on your skin, lacerations, infections? Any headache, dizziness? Any vision changes, itching or drainage from your eyes? Any tinnitus or problems hearing, drainage from your ears? any nasal congestion or drainage, any nose bleeding, any sore throat, dental pain or gums bleeding, and your neck, any lumps, bumps, tenderness, any lumps or bumps in your breasts, any nipple drainage, any cough, shortness of breath, or wheezing, any chest pain or fast or skipping heartbeats, any swelling in your hands or feet, any nausea, vomiting, diarrhea, or abdominal pain, any urinary frequency, urgency, or pain when you urinate, any, I know your back is hurting, but any other joint or bone pain or swelling, any numbness or tingling in your hands or feet, any balance problems, any bleeding or bruising that would be unexpected, any frequency or any feeling of increased thirst or peeing a lot or weight changes that you weren't planning, any suicide thoughts or homicide thoughts, depression, anxiety. So we'll move on to our exam. We're going to start with your skin, and we're first going to just kind of look you over for any lesions, moles, wounds, anything like that. We'll kind of start with the head. You had said that there's a couple moles on your back that I'm going to look at here, and then one on your stomach that I'll look at. Alright, and then looks like you have a spot there. Next we'll palpate, and I'm checking texture and fullness of your hair on your head, any hair on your arms, legs. We're checking to feel for temperature, moisture. I'm going to check skin turgor right here. So we're going to check your nails, capillary refill. I'm going to check your feet, capillary refill, and check those nails. Looks good. Alright, we're going to move on to some silly questions. What day of the week is it?
Wednesday.
What city are you in?
Savannah.
Who's the president?
Trump.
I'm going to tell you 3 words that I want you to try to remember. Cat, dog, and horse. I'm going to have you count backwards by 7s from 50. So 50, then 43.
Then 36, 29, 22, 15, 8, 2.
8, 1, 1. That's good. We're going to move on to some of your cranial nerves. So we're going to start with number 1, which is olfactory. I'm going to have you close your eyes. I'm going to put scent by that and just tell me what the scent is.
Yeah.
Good. And keep them closed. We'll do the other side. Tell me what that scent is.
Cinnamon.
Perfect. We'll move on to 2, which is your optic. You can open your eyes. We're going to do the Snellen chart here. Cover your left eye, and with your right eye, read the bottom line.
P-F-O-D-T-E-L.
All right. The other.
P-F-O-D-T-E-L.
And both.
P-F-O-D-T-E-L.
Perfect. We're going to check your pupils here. And this is for 2 and 3. All right. And then if I had a ophthalmoscope, I would check your retina. And then for 3, 4, and 6 were extraocular movements. So with your eyes, follow my finger. And then follow it to the center. Good deal. And then we're going to do some sensory. This will be the trigeminal. Close your eyes and tell me if it's sharp or soft.
Soft. Sharp. Soft. Sharp.
All right, good. And then go ahead and open and close your jaw like you're chewing. And swallow. All right, next we're going to do facial. So I'm going to have you open your eyebrows up, smile, frown, puff your cheeks out. Good. We're going to move on to acoustic. I'm going to whisper. Tell me what I whisper.
Cat. Dog.
All right, that's good. We're going to move on to 9 and 10. So you're going to say ah, and gag, or we would do the gag reflex now. We're going to go on to the spinal accessory nerves. Shrug. Head. Good. And then the last one is hypoglossal. We're going to have you push with your tongue. Push with your tongue. Okay, and open your mouth. Move your tongue side to side. And then up and down. Good. I'm going to check some more sensory just across your body. So sharp and dull again. Close your eyes.
Soft. Sharp. Sharp. Soft. Sharp. 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 Soft.
All right, perfect. All right, we're going to move on to coordination. So what I'm going to have you do is with your hands, I'm going to have you kind of put them here and go back and forth quickly. Good. Now with your finger, I want you to touch your nose and then my finger repeatedly. Good. Good. So we're going to do with the feet now. I'm going to have you go up and down with your feet. Good. And then with this shin, knee down the shin. That one, knee down the shin. Good. All right, we're gonna move on to strength. So I'm gonna have you bend your arms up, push me away, pull me close, pull out, pull in, put your arms down, open your fingers, don't let me close them. Now close your fingers, don't let me open them. Take your finger to each thumb, and then go like this, don't let me open it. Good. While we're up here, I'm just gonna check your joints, let me know if you have any pain. First I would visualize for muscle contour, symmetry, any wounds or injuries. So pop it here. What I was saying, pop it here. The wrist, not fast, there's bones. Alright, I'm gonna check range of motion. Lift your arms up and down. Go like this and go out and back. Put them behind your back, put them in the front. Your elbows bend this way and straighten down, and then turn this way and turn that way. Wrists go up, down, side, side. Spread your fingers out, spread your thumb out and in. Spread your fingers in. Good. We'll move down to the lower extremities. We'll go ahead and pull up, pull down, push in, push out, push away. Pull in, lift up, lift down, spread your toes out, spread your toes, push your toes in, lift your toes up, lift your toes down. That's good. Check these joints, their movement. These joints. Alright, we're going to go ahead and have you stand up. And you're gonna walk towards me on your heels. Good. Walk back on your toes. Hop in place. Right, close your eyes and look up. Keep your eyes closed, put your palms up. Good. Move on to your back while you're standing. And then just let me know if anything hurts when I'm palpating here. And bend all the way forward. All right, stand up. Lean back. Lean to the right. Lean to the left. Twist to the left. Pain when you do that?
Yeah.
Twist to the right. Good. With your head, chin to your chest. Look up at the ceiling. Look to the left. Look to the right. Ear to your chest. Yep, the other ear down. Good. All right, you can go ahead and sit back down. We're going to do some special tests here now. So I'm going to put cold things. Close your eyes and tell me where the cold is.
Right arm. Left arm. Right leg. Left leg. Left. Back.
All right, good. I'm going to put something in each hand and tell me what it is.
AirPods. Cotton ball.
Okay. I'm going to draw something in your letter on your hand. Tell me what it is.
A. C.
Okay. That's good. Your hand. I'm gonna lift a finger or lower finger. Tell me which way it's going.
Down.
Okay.
Up.
Good job. All right, we're gonna do some tests for your shoulder. We'll start with the Neers test. So I'm gonna put this arm up. I'm gonna push back here. Any pain in your shoulder?
No.
Hawkins test is in. Any pain in your shoulder?
No.
I'm gonna do a drop can test. So try to prevent me from turning your hands to a drop can. Any pain in your shoulders?
No.
And then drop arm, hold this up here and leave it set. Good. So for the hands, the talon, let me know if you get numbness in your fingers. And then the phalanx, put your hands like this, press inward. We would have her do that for 60 seconds and see if there's any numbness in her fingers. You can go ahead and put that down. We'll have you lay down with your head this way, feet that way. Yeah, no, head this way, feet that way. All right, we're gonna do some meningeal signs here. So we will push your head to your knees, and I'm looking for any flexion in her hips and thighs, any pain or inability to do that. We do the straight leg test. Up, lift up, any pain in your back, or movement there. We'll do some special knee tests now. We'll do if we're worried about the meniscus, we do the Curry, and we'd be checking for a pop or pain. Leachman's is twisting opposite, any pain or popping. We got vagus and valgus is inward and outward. For those, we've got the balloon or bulge test. Pinch up and look for fluid under the kneecap. And then we're going to do the drawer test. Anterior and posterior drawer test. Push in, check for movement, pull out. Do this with the ankles too, in and out. All right, and bring your legs back around. And check your reflexes. So rest down. Rest it. And then rest your hand over. Do it this side. Thank you. And then again, rest it over here. And then check your legs. A little hyper reflex over here. That foot. That foot. Alright, so I think that is all for today. Thank you for coming in. I think you're right. I think you do have a strain. Can you tell me those 3 words that I told you earlier?
Cat, dog, horse.
Good job. Is there anything else you can think of for this visit? Alright, thank you, Kayla.